ahead and say something first.
I'm extremely excited that the vaccine is finally here. You know, I compare this to turning lights on. Every time one gets vaccinated, one light in Muscatine gets turned on. Let's fill it up with all the lights and as many as we can.
How do you feel?
No problem, yeah.
Just a shot.
Okay, yeah, I feel good.
Is this gonna mean that you don't have to worry about a mask or social distancing now?
No, I think that needs to continue. First dose gives you maybe 50% protection. After the second dose, you're talking about 95%. But you still need to follow all those things, you know. Watch your distance, wash your hands, and wear a mask. You need to continue doing that.
Can I talk to you on phone?
Sure, yeah.
Okay. Can we have him back for a second? Okay. So exciting, super exciting, right? So we just administered, well, not we, I didn't, the first vaccination here in Muscatine, and that's super exciting. Dr. Nadkarni, obviously, was the first recipient. That's who they just saw get the vaccine. So how was that choice made as far as who would get the first vaccine and how we would get started?
Dr. Prasad has been super excited to receive the vaccine. He's well educated on the information and is a huge fan of the outcome. As you heard him say, he's looking at shutting a light and getting all the lights turned on.
Yep.
It's a really great way to say in the darkness, seeing the light at the end of the tunnel with the vaccine. Prasad's been a surgeon with Trinity Muscatine for numerous years, almost 13. He's actually close to retirement, but he's going to stay on med staff and continue to provide services in Muscatine. And again, he was one to raise his hand and say, I want to be the first.
Yeah.
So that's why he was selected.
That's awesome. I mean, I think everyone in Muscatine knows Dr.
Absolutely.
Nadkarni, has either seen him or, had surgery done by him.
Yep.
So he was a great first choice.
Yep.
And so as far as the administration of the doses that you have now, that's going to continue on throughout today since the doses are here. And then what's next?
Yeah.
We don't know.
So we have 500 doses for the whole county. 300 of those will be administered in public health for all of our frontline healthcare workers throughout the whole Muscatine County. So they will be working over there today to help with that, and then they have another day scheduled as well. Here at Trinity Muscatine, we have 200 doses to allocate to our team members. We have tiered all of our team members so that the frontline healthcare workers that are treating COVID test positive patients will be the first to receive.
Yep.
We will continue to administer till we run out of vaccine, and we're hoping we'll continue to get vaccine early next week, and that'll be all determined upon the allocation.
Sure. So overall, how is staff feeling as far as getting those vaccines? I know even yesterday you weren't sure, like when it would actually show up. And so how is the staff, I guess, feeling as far as being able to have that vaccine and get started on this process?
They've been anxiously awaiting. We have line outside right now ready for additional team members to come in. We have very full schedules. As a Quad City region, so all of our team members, because we were able to start in Rock Island and Bettendorf, we're about 90% of our team members that are electing to get the vaccine.
Wow, 90% is a
Yeah.
pretty big number.
Yep, we're ready.
Yes. And like we said before we even went live, this has been a really long year for healthcare workers,
It has.
and I'm sure that they're excited to just get the process started of hoping to kind of get back to some normalcy. And as far as the vaccine goes, can you just tell us quickly, are there any side effects, the people who have gotten it so far up in the Quad Cities? Nothing?
We've seen minimal side effects, if
Okay.
anything, a little bit soreness in the arm, which
Yep.
is normal
Right.
for most vaccines. And, very minimal adverse reactions. And we
That's
have
awesome.
a team of professionals here ready to support if there is an adverse reaction. But we've been doing well throughout
Yeah.
the entire region in the system.
So far, what I saw this morning as people were getting ready, as your team was getting ready to administer the first one, everybody knew exactly what they were doing. They had been trained, and it went very smoothly.
Yeah.
You could tell Dr. Nadkarni was excited to be the first person. It's very exciting for the community to get started on this. I know everybody's kind of been waiting to get this process going. So that's an exciting day. Anything else that you would like to add before we
Yeah.
head off?
My two things would be, one, as Dr. Nadkarni said, continue to wear your mask, continue social distancing. We definitely want to keep the surge down and don't want to relive a couple of weeks ago. That was a really trying time. So anything the community can do to continue to support each other and our healthcare workers by following those same practices. Like Dr. Nadkarni said, it takes the second dose before we start to see some positive and, rethinking those social distancing measures. Last but not least, I have to personally thank all of our healthcare workers. They have been phenomenal. Couldn't do it without them. The blood, sweat, and tears that I see them do on a daily basis and continue to get up and come in every day will be something I will never forget in the rest of my life.
Yep.
It's been an amazing year.
Yeah, it's been, you don't hear that very often, but it has. It's
Yep.
truly made a lot of people really grow and kind of get outside of that box that we're kind of used to, that norm. People have definitely had to get outside of that and work together in a whole new way. And from Discover Muscatine and the community, we also thank you guys for everything that you guys have done so far.
you.
Yep. All right.
That's right there.
Prasad is here. We're just a quick couple. So how are you feeling? It's been a few minutes since the first dose here in Muscatine.
Feeling fine.
Feeling fine, just like a normal shot or anything.
Feels like a flu shot.
Okay.
Little achiness, nothing bad at all.
Yep. And I know you kind of mentioned this, but you're excited about the vaccine, and as a medical professional, for me, that's really exciting to hear. It's comforting to hear.
Right.
So, but you aren't afraid at all of getting the vaccine or being the first person in Muscatine to do that.
Not at all. I mean, you see Vice President Pence taking the vaccine, our future President Joe Biden taking the vaccine. It's extremely safe.
Yep. So it is a safe vaccine, and they will continue to administer that to frontline workers today. And then when will you get your next dose?
So this is Moderna vaccine. So the time period between the two doses is 4 weeks.
Okay.
So it is 4 weeks or longer.
Sure. Okay. So about 4 weeks until you get that second dose and
Correct.
really start. But you did say even after getting the vaccine, you should still do the things that we've been told to do, which is
Correct.
wear a mask.
Right, the 3 W's,
Yep.
Wash your hands, wear a mask, watch your distance.
Yep.
That's important.
Awesome. Well, thank you so much for letting us be a part of this and letting us watch for the first vaccine here in Muscatine.
You're welcome.
Thank you.